Hey guys, I'm Dr. Tim Pavlak. I'm a physical therapist and the owner of Physio, Orthopedics, and Performance. We're here inside of Cuyahoga Falls CrossFit, and this is DPTRX. DPTRX is a video blog designed to give you the tools to keep you healthy and moving like an athlete. Today's episode, we're covering treating sciatica. Sciatica, a term that doesn't mean anything, assigned a lot of times to people who have any sort of nerve pain going down the back of their leg. I've had patients tell me they have nerve pain going in their arm called sciatica. So we're going to break down what sciatica is, the diagnostic category being spine derangement, piriformis tension, or sciatic nerve tension, and then give you some treatments for each of those diagnostic categories. Each of these three things can lead to that nerve pain shooting down the back of your leg, which is a nerve distribution for the sciatic nerve. Number one, a spine derangement. The nerves exiting your spine can be pinched, and through a series of repeated motions, we can unpinch and basically take away that nerve impingement and take away the pain that's going on your leg, a lot of times in the lumbar region. So we'll show you those exercises. Number two is piriformis tension, where the sciatic nerve exits in the glute area, in the deep glute area. It exits in the same frame, the same exit area as the piriformis, which is a muscle that works the hips. And a lot of times, if the piriformis is tight, if the piriformis is irritated, it'll irritate the sciatic nerve and send nerve pain going down your leg. And number three, sciatic nerve adhesion. So not only in that glute area, but also all the way down your leg, that nerve could be here between tight tissue. A great thing for this is trigger point joint healing. If we get into the glute, if we get into the hamstrings, we can loosen up those muscles, and where those muscles are clamping down on that nerve, we relax them, which takes away that nerve pain. So a great reason to head over to physioorthoperform.com and sign up for an appointment with me. Give me a second and we'll get into that treatment. All right guys, so three diagnostic categories. Number one is the spine derangement category. So what we do with that is repeated movement. Basically the idea is the discs between your spinal column are like jelly donuts. So through repeated movement, we can cause a permanent change and a permanent movement of that disc, that jelly donut, into a position where it's not impinging on the spine and sending that nerve pain down your leg or numbness and tingling down your leg. So what you're going to do, you're going to be on your chest like this, your hands at your side, neck looking for the ceiling first, and you're arching your back. Get up to as high as you can where your hips are still on the ground, so not super high for me. Come back down. You're going to hold it for 2 seconds once you're in the air. You're going to repeat that 10 times. You're going to do it throughout the day 10 times every hour. And you're probably saying, Tim, I don't have time to get on my stomach in the middle of my workplace and do it, or while I'm driving and do that, or anything like that. So what you're going to do is you can do it standing, where you're going to stand up, your hands are on your hips, look to the ceiling, let your hips come forward and lean back. Don't fall over, or you have to come see me. And do the same thing. Hold for 2 seconds, repeat 10 times. So that's addressing the spinal derangement. Number two, piriformis tension, where the actual sciatic nerve is being pinched by the piriformis in the deep glute area. 2 heads of the piriformis, 2 stretches I'm going to give you. Both on your back, one leg straight, the other bent, up to your chest or up to your shoulder, and then to the opposite shoulder. That's the key. The stretch should be through here. So to your chest, opposite shoulder. You're going to hold that for 30 seconds to 2 minutes, 3 times. Number two, you're still going to be on your back. You're going to go your leg in figure 4 position. You're going to grab the leg that's underneath. You're going to pull that to your chest. You're going to feel that deep glute area, but a little bit different. This is addressing the piriformis, where the sciatic nerve could be being impinged. Number three diagnostic category, sciatic nerve adhesion. So like I said, where the nerve is gliding out of the foramen all the way down, splitting into different smaller nerves and going all the way to your toes, it could be impinged. And so what you need to do is do a nerve glide. You're going to sit, foot in front of you, scoot to the edge so your knee can be straight, toes pointed towards you. So I'm in full dorsiflexion, full knee extension. Hands on my leg, I'm sliding down. You're going to get to a point where you start to feel those symptoms, okay? When you feel those symptoms, you're going to back off and you're going to go back into it. You're going to back off, you're going to go back into it. You're going to roll through that 30 times, okay? I want you to do that throughout the day whenever you think about it. So, 3 diagnostic categories. If you're doing a movement and it's helping you, that's the category you're in. So if you're doing the repeated movement, If you're doing the piriformis stretch, or if you're doing the glides, that's the category you're in. If you're doing something and it's making you worse or not affecting it whatsoever, then you need to cut it out, okay? So again, Dr. Tim Pavlak here, inside of Physio Orthopedics and Performance, located inside of Cuyahoga Falls CrossFit on Graham Road. Check us out on physioorthoperform.com. That's physio, P-H-Y-S-I-O, and I hope to see you soon.